Welcome back to Cancers 101. I'm Rittika, your host. Today we are diving into an intriguing topic: how cancer cells manage to cheat death. Specifically, how they evade apoptosis, the process of reprogrammed cell death. We're exploring the mechanisms behind this, like BCL2 overexpression and caspase inhibition, and discuss how cancer cells use these tricks to survive and proliferate. As always, I'm joined by Aditi. Welcome.
Hi Ritika, it's great to be here today. We all know cancer cells are relentless, but one of the key reasons they are so hard to treat is their ability to avoid cell death, even when they should be dying. Let's break it down.
To start this off, let's begin with a basic concept: apoptosis, which is programmed cell death. This is the process by which cells essentially decide when to die, often when it's damaged or when it's no longer needed. It's a natural mechanism that helps maintain balance in the body. Think of it like a safety switch that prevents cells from becoming cancerous. But in cancer, this safety switch is often turned off, allowing cancer cells to escape death and continue proliferating.
Exactly. One of the most well-known ways cancer cells do this is by overexpressing a protein called BCL2. BCL2 is a part of family of proteins that regulate apoptosis. Normally, it helps to keep cells alive by blocking the signals that would trigger cell death. In cancer, BCL2 can become overactive, essentially putting a no entry sign on the path of apoptosis, preventing the cell from dying even when it should.
This overexpression of BCL2 is seen in several types of cancer, especially lymphomas. In these cancers, the overexpression of anti-apoptotic proteins like BCL2 prevents cells from going through the normal programmed cell death process, even when there accumulated significant DNA damages. This is one of the reasons why lymphoma cells are so difficult to get rid of. They simply won't die when they should.
And it's not just BCL2. Another way cancer cells avoid apoptosis is by inhibiting caspases, which are enzymes that play a key role in the final stages of apoptosis. Caspases are like the executioners of cell death. They break down the cell from the inside once the process is triggered. Cancer cells often produce inhibitors of caspases, stopping this final execution and allowing the cell to survive longer than it should.
So, cancer cells are essentially playing a game of stop the clock. They're either blocking the signals that trigger apoptosis or preventing the execution phase. This ability to cheat death gives them an edge over normal cells, allowing them to accumulate mutations and grow uncontrollably.
Now, here is where it gets interesting. Many of the pathways that cancer cell hijack to evade apoptosis actually come from developmental signaling pathways. These are pathways that normally help cells survive and differentiate during development. But in cancer, these pathways can be reactivated or co-opted to prevent cell death.
For example, proteins like survivins and IAPs, inhibitor of apoptosis proteins, are normally active during development to protect cells as they divide. But in cancer, these same proteins are upregulated, further inhibiting apoptosis, allowing the cancer cells to thrive. It's like a developmental survival mechanism that cancer cells have learned to turn back on to protect themselves from death.
So now that we understand how cancer cells resist apoptosis, the big question is, how do we make them die when they refuse to? Well, one promising approach is using BH3 mimetics.
BH3 mimetics are a class of drugs that are designed to mimic the action of BH3 only proteins, which are a part of BCL2 family. These proteins normally trigger apoptosis by binding to and neutralizing the anti-apoptotic proteins like BCL2. By mimicking these natural death signals, BH3 mimetics force cancer cells to undergo apoptosis, essentially turning off the switch back to on.
One example of a BH3 mimetic is venetoclax, which has been used to treat chronic lymphocytic leukemia (CLL). It worked by specifically targeting BCL2, blocking its anti-apoptotic effects, and allowing the cancer cells to die. It's a great example of how understanding the molecular pathways in cancer can lead to development of therapy that directly target the mechanism cancer cells use to evade death.
Let's look at real world example. Take Jake, a patient with chronic lymphocytic leukemia who was treated with venetoclax. Jake's cancer cells had high levels of BCL2, which was preventing apoptosis. After starting venetoclax treatment, the drug effectively bound to BCL2, restoring the apoptotic process and leading to significant reduction in tumor size. This is exactly what we want to see. A therapy that turns off the cell death pathway in cancer cells and that has been resisting it for so long.
It's amazing how these therapies can target specific molecular processes and reprogram cancer cells to die, something that traditional treatments like chemotherapy can't always do. This precision medicine approach holds a lot of promise for improving patient outcomes.
To wrap up today's episode, cancer cells have developed several ways to evade apoptosis, from overexpressing anti-apoptotic proteins like BCL2 to inhibiting caspases and co-opting developmental survival pathway. These mechanisms allow them to cheat death and continue growing. But with new therapies like BH3 mimetics, we have a force to put the cell back into death cycle or apoptosis, offering new hope for patients.
It's incredible to think that by understanding these mechanisms, we can create targeted therapies that specifically address the cancer cells' ability to avoid death. It's a big step forward in cancer treatment.
That's all for today's episode for Cancers 101. Thank you so much, Aditi, for sharing her expertise, and thank you all for listening. If you have any question, feel free to reach out to us.
Thanks for having me, Ritika. It's always a pleasure to talk about how we are learning to outsmart cancer. See you next time.
Take care, everyone, and remember cancer cells may try to cheat death, but we are working hard to make them face the consequences. See you soon.